Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson, and as always, I'm joined by RipsyTech founder and CEO, Tom Tarshis. Hi, Tom.
Hi, Parker. Nice to see you. It's exciting times here at RipsyTech.
Always, yes. Well, I was going to say always exciting times, but particularly exciting times right now, I would say. Do you want to fill the audience in on why we're excited?
Oh, yeah. We just released our first of hopefully many commercials highlighting some of our amazing EHR features. And I feel justified in saying amazing because the features we've put in have literally given me 10 hours back of my life each week by automating. As we've talked about, insurance billing and non-insurance billing, frankly, are some of the biggest headaches of running a practice. And it's hard to simplify something as complex as billing, but I feel like we've been working very hard the last 18 months on these features and want to highlight them. And I think what it could do for practices as far as eliminating painful reading paper documents, typing things in that cause errors, automating patient payments, getting the insurance payments in, getting rid of we don't want to cause massive job loss, but making it that you don't need to spend as much money on extra support in order to collect bills or payments. Like that's what I think we've accomplished. And I'm super proud of the commercial that you and Ryan worked very hard on, and it is awesome professional quality. And yeah, I think that plus all of our new clients that we're signing up and hopeful about, and we might break a new time zone soon.
Right. And
yeah, that's super cool. So and I think the feedback we've been getting in general from all our new clients has been very, very kind. So I'm excited about where we're at and to see where we're headed.
Yeah, I agree. Very exciting times. And just to shout out Ryan, you're referring to Ryan Myers, who is one of our product launch specialists at RipsyTech, and he works on all of the editing for all of our videos. If you're watching this podcast episode right now on YouTube, he is the one that edited all of the backdrop and everything together with the questions popping up at the bottom. So I'm sure he is listening as he's editing right now, and I hope he's got a smile on his face.
He usually does. I think most of our staff usually has a smile on her face, which is nice.
Right. So yeah, as you said, we are very proud of all of the innovation that we put into our billing system, and we did work really hard on getting that commercial together. That is not specifically what we're here to talk about today for today's episode, but it is in general something that we're very proud of. But just to quickly pivot to today's topic, we are going to be talking about something that we have also been putting a lot of time and effort into over many months, lots of collaboration, lots of thinking. This is something that we support as a feature and something that we also have plans to, further enhance in our system, but it's also something that is, a large topic that pertains to perhaps where mental health care is going to some degree, and that is measurement-based care. And that, not necessarily something that is specific to a system, but it is a very big topic in terms of, clinical modality and how we treat patients. So let's get into it. I'm going to pick your brain a little bit here. So I want to hear from the expert, what is measurement-based care and why is it important for a mental health practice?
Yeah, and if people had listened to the initial intro podcast, that they may know that I have my master's degree in epidemiology and biostatistics, and measurement-based care is something near and dear to my heart, and it goes all the way back to my academic training. And it was when I was in my fellowship and working on bullying in elementary schools is when I really realized we didn't have a good measure for assessing bullying in elementary school students. And there was this one questionnaire that was used often, and then I was looking at it and I realized, well, wait a minute, no one's ever published any psychometric or validity data on this questionnaire. And it gets to the point that if you don't have a good way to measure something, you're sort of spinning your wheels, or you're making it impossible to really track if what you're doing is helping people. And, so in general terms, measurement-based care means trying to get appropriate measures to track what you're treating in whatever healthcare industry you're in, so that you can assure that that treatment is going well. And there are a lot of unique challenges in the field of mental health that we've hinted at before. The main one being that a lot of measures of outcomes in mental health are subjective. So we don't have a blood test. We don't have imaging. We do have some objective things like trips to the emergency room for psychiatric issues, or for kids, days of missed school, without a doctor's note, that are objective on some level. But we've struggled for a long time, and you've worked on this with me over going back many years, that we really need to do better at establishing measurement-based care in mental health. And this is really what I feel could revolutionize the entire field, and which is why we have spent so much time at RipsyTech thinking about this process, how it's evolved from what I used to do when I started almost 20 years ago to what I think we're at now, and thinking about how to make it even easier in the future. I think that's a long-winded answer to the first part of what is measurement-based care. The second part of your question was, why is it important for mental health practices? Mm-hmm. In pure honesty, the reason it's important right now is so that patients and the providers can see clearly who's getting better and who isn't. That is why this is important. The other piece within here, which although it's talked about a lot, in all honesty, I don't see it as a reality yet, is that we're trying to, insurance companies and other systems of government want to see more definitive proof of good outcomes in care. This is talked about all the time. I think if you look at any of the new mental health startup websites, they're all about measurement-based care, evidence-based practice. Mm-hmm. The reality is the demand for mental health services so outweighs the supply that in those scenarios, it's not so much about good outcomes or measurement-based care yet, but hopefully we are headed in that direction.
So would you say it's, instead of it being about good outcomes and good measurement-based care, it's just been about providing care?
That is what the field is about, and still is about, even though you see allusions to evidence-based practices, better outcomes, et cetera. We're just not there yet.
Well, so yeah, let's talk about those better outcomes. Specifically, how can measurement-based care impact treatment effectiveness? Does it have any impact on patient engagement?
Yeah, great question. And when I started my first clinic in 2007, I was very into giving lots and lots of questionnaires to parents and kids, to the point where I think people were answering 250 questions on 5 or 6 different questionnaires. And at that time I was sort of like the more the better. I think the demand outweighing the supply meant that the families were usually compliant in doing those questionnaires because they wanted to see a provider. But as it's evolved over time, I've really realized that giving hundreds and hundreds of questions is both going to maybe not get honest answers, and it's just too much of a burden and hard to be something that's repeated over care. And so where it's really been headed and where I think we've evolved to is getting the right number of questionnaires, including some tracking items that are very easy, that we can take advantage of technology and that everyone has a smartphone now to get more regular measures of how patients are doing, and then make nice graphs that both show clinicians how their patients are doing and getting better, and can be tools for patient engagements where the patients themselves can see how they're doing in different aspects of their life over time. And there is very good research that when you do some of these measures and or use it in your therapy or treatment with patients, it does increase that engagement and can lead to very healthy conversations about where treatment is going and actually improve the treatment process. And so that's where that's what we're working on at RipsyTech, and where I've evolved over all these years as let's simplify, streamline, and present data well from multiple sources to all parties, and that's going to be how we can best get good outcomes and good measurement-based care in the field of mental health.
Yeah, that's really interesting that you bring up the initial approach of 250 questions, the more the merrier, and then as it's kind of evolved, kind of realizing this might be a less is more kind of area where it made me think about like the lean practice of management of focusing on improving efficiency while also improving quality, shortening it down while keeping the quality good, if not better. And then, it kind of seems like that's kind of, it's, that kind of is just how everything has evolved, and measurement-based care is no stranger to that either. So, with that said, there are challenges to implementing it. It is kind of a big change if somebody is not already using measurement-based care in their practice, and it's not something that you just kind of go from 0 to 100 overnight. So I'm kind of wondering, what are some of those challenges that somebody could encounter when deciding that they want to implement this into their practice, and how might they overcome some of those challenges?
Yeah, and I think we're aware of this, and the reality is that most mental health clinicians do not collect outcome measures on a regular basis, and a lot are not necessarily interested in that. If your practice is full and things are rolling along fairly smoothly, why would you introduce something new that would be a change? And when I was running our big clinic groups, we actually had to embark on a big employee education process to try to engage all of our clinicians to see why this could be helpful. So what we want to do is find simple ways to ease people into measurement-based care and actually show that it can be really cool, even if you're not a nerdy number type statistics person like we are. And I think, Parker, we've talked about this a little bit, but we're very excited about our KISFA questionnaire, which is a keep it simple functional analysis tool, which it's either 4 or 5 questions that are a 0 to 100 scale. And we presented our research that this mapped very well to a much longer questionnaire on psychiatric symptoms. And so, I think for people who are very resistant to measurement-based care, having a questionnaire that you could give when you first meet the patient and then put it on autopilot to send a text message once a month to the parent and patient, or just the patient, depending on the age. And then it takes people 15 seconds or less to do, so your patients aren't annoyed by it. And then you get a really pretty easy to understand graph on how people are doing. I think that can be very powerful to convert people to seeing the value of measurement-based care. And that's what, I recommend for anyone who feels uncomfortable as a way to start. And we make that easy to do in our software. What I would hope the next step would be is, to, depending on the patient and the diagnosis, there is still value in doing some more specific questionnaires about depression or anxiety. And we do some broad screening ones at our clinics right now. But being able to customize, and then depending on what you're treating your patients for, I think you can still get pretty good compliance with some reasonable free questionnaires and increase your revenue a little bit because insurance companies pay for questionnaire completion. That's where we'd like to see people get to. Yeah.
So what about like the timing of the delivery of the questionnaire? So I mean, you're talking about the KISFA, making it as easy as being able to send it to them ahead of time, have them fill it out ahead of time. But what about for some of those like longer questionnaires? I know in our experience when we try to incorporate a little bit more outcome measures in like an IOP program, for example, a lot of the concern that we typically heard from the clinicians working in those programs was it didn't feel natural at any time to, provide a survey to a patient like at the beginning of the session. I know, but I think oftentimes that is the recommended thing to do if you're planning on giving a survey at the beginning of like for a session. So I guess what thoughts do you have there in terms of like, recommended ways to guide that conversation of, if you're going to be delivering a questionnaire to a patient, in person on the day, as opposed to sending them like some kind of message ahead of time?
Yeah, no, great question. And a lot of this depends on your clinic setup. So there is, if you have a front desk staff and a little waiting room, and we used to take advantage of this, having some iPads set up with the questionnaires that can be completed in a couple minutes before your session, it's very easy and very good compliance to hand someone an iPad and say, hey, could you answer these questions? There are numerous clinics throughout the country set up for all medical disciplines that you sort of walk in and check in on an iPad, and then it gives you a questionnaire. Or if you check in ahead of time, it may ask you to complete a questionnaire. So that is a strategic way to do it, and it's something that is possible with our EHR. If you don't have front desk staff because you fired everyone because you didn't need it anymore because billing got so much easier,
Oh, no.
then it little humor in there, of course.
Yeah.
Or in our current situation where, there's not that admin help, you don't necessarily want to take a big chunk of your time watching a patient fill out a questionnaire. So then it's a balance of, do you send the text message ahead of time to the parent or teen or youth or the patient? There's no one right way to do this. I think the biggest piece is, how does it seem to be the least burden to the person doing the questionnaire, and how do you get completion of the questionnaire, which is what we suffer with. I shouldn't say suffer with, but is what the biggest challenge is. What we tend to do is actually, after we do sort of a wrap-up session and show people their graphs and scores the first time, is let them know, hey, you're going to get a link once a month to complete this, that doesn't necessarily correlate with their next appointment times. But once they've seen it and people are always like, oh, that's interesting, then I think we have a little buy-in and engagement, and that feels like the right time to let them know, you're going to be doing this once a month for us.
Yeah, that's a great, great, well said. Right now I'm thinking a little bit about, what about the patients who might not want to fill out a questionnaire, or I guess on a frequent basis. In this case, you're talking a lot about, something that is simple and just a few questions that they could fill out once a month. And hopefully that's not too much to ask a patient to, want to fill out for themselves, because it is going to benefit the care that they're provided. But, how might you approach a patient who is resistant to some frequent assessments, and, how might you manage, that aspect of, successfully implementing measurement-based care in a practice?
Yeah, and good question. And this definitely is highly correlated with how comfortable and important the clinician thinks measurement-based care is. So you will have some patients, of course, that, answering questionnaires about trauma symptoms or depression is triggering and harmful, and they don't want to complete them. And even you'll have patients that don't want to do a monthly 10-second rating scale on how you're doing, and that will invariably happen. And so you need to be able to have a way to respect that and turn that feature off until people are ready to do some of those outcome measures. But the biggest factor in getting people interested and willing to engage is actually how you are as the provider in saying, hey, look, we've got these problems you came in for. Let's set some goals. What's going to help us solve those problems faster is if we really have these regular check-ins, not just me saying how you're doing, but you on your own completing a few questionnaires outside of session. And that's going to help with the whole treatment process. And, if you can get that message across and sort of show your excitement, people will buy in and go for it. But if you're very lukewarm about it, or make a oh, I know it's annoying to do this once a month, if that's the attitude you present as the clinician, that's going to come across, and then that's going to hurt compliance. With the outcomes.
So you've talked a lot. You've talked a lot about ways to deliver this, and you've talked a lot about, Ripsy's own capacity to deliver measurement-based care if somebody's interested in it, as it is something that we do offer. My next question, it might kind of come off as like a miniature advertisement for ourselves, but I'm just kind of curious, how does technology play a significant role in measurement-based care? What types of software or systems are typically most effective for delivering measurement-based care? And I specifically do ask about technology because I'm a big proponent for not doing something like this over pen and paper as a data person, just because it saves a lot of time to have it all digitally. Anyway.
Well,
go ahead.
Just to give a little ancient history here, when I was a senior in college, my first job was working at Kaiser Division of Research, and my job as the senior Cal student was looking at the patient questionnaires that had been mailed back for something like a cardiology study, and then we had complex algorithms for, okay, if a patient marked question 3 between choices 2 and 3, how do we code that and circle that? And so you're just to the point of, it is much nicer using technology where people can't choose something that doesn't exist and just write a little comment or, so that for missing data and things like that, like the use of technology is for those of us who didn't have that when we started our careers. I just do love that.
Well, just to quickly piggyback off of that, I think my favorite data collection story would be somebody filling out, it's a questionnaire where it's a line on a piece of paper and they have to mark where on the line, and it's really, for us, it would be a 0 to 100 slider scale, but when somebody does it on paper, then time to bust out that ruler, measure how long is the line. If they give it an X, where exactly is the X converging on the line to delineate this is exactly where they indicated, and then running a quick division problem to figure out, okay, from 0 to 100, what was the indication here? But yeah, when you're doing it through technology, it's just so much easier.
And Parker, there are numerous companies that have sprung up that are just dedicated to collecting these outcomes. And I think one of our goals at RipsyTech is to do things ourselves and not be an EHR company that has a ton of different plugins that make our product clunky. And also then if there's a bug or error with that piece, that we can't fix it ourselves. And so, our goal at Ripsy, one of the first things we built in were outcomes measures and getting the questionnaires into the EHR, and using the different tools between emailing links for the questionnaires, texting links to complete questionnaires, having it able to do on an iPad or a desktop machine at your clinic. We have all that stuff built in. And then within our software, right now there are 500 or more well-validated mental health questionnaires, which by itself tells you there's a problem when there's that many questionnaires for one field. So we have put in what I feel are the best of the public domain questionnaires. There are some other questionnaires that might be nice to see there, but again, and a good example is the strength and difficulties questionnaire, which it is public domain, but we pay a licensing fee to put it in, but we were able to design it to be integrated, and so we know it won't be clunky or hurt our software. Some other questionnaires mandate that you can only use their little window pop-up to do the questionnaire, and we're not going to make our product clunky or slow, so we're not going to use those. And there's so many other good options. But so we have lots of questionnaires in place. We have lots of means of delivering them to multiple providers. So again, when you work with kids, you've got to check with the parents and teachers and the kids themselves and integrate those findings. And now we're working on a little more customizability for people's practices, that, okay, if I see someone this age with this diagnosis, just letting people, we can give our recommendations, but if someone's where I was at 17 years ago and wants their patients to complete 250 questionnaires, I might say, hey, let's have a conversation. But if they want to do that, we want to give our clients the ability to do that. And so,
right. That's where we put in a
warning.
Yeah. I was going to say that's where we put in a warning to, cite some kind of study saying, about like questionnaire fatigue. Once you hit a certain number, it becomes less effective. Just so you know, but also, not limiting them from being able to do that if that's ultimately what they want. Getting good ideas for development.
Yeah, and then Parker, as our user experience lead, this is a lot of making it easy for our EHR users and their patients to complete this information is paramount to us. So,
yeah, it's been a really fun process learning the ins and outs of measurement-based care. I think when I when I came back after grad school to work with you and work at Ripsy about 3 years ago, I was already familiar with, patient outcomes. I really thought it was something that everybody was doing, or at least everybody ought to be doing, or at least something that everybody thought that they ought to be doing. And so to kind of learn more about it and go to conferences and attend talks and really learn that this is not something that is super standardized and not widely adopted was pretty surprising, but also seeing it as something that you think just, hey, this makes so much sense for this to be there and to be the user experience person is a very exciting problem to solve. So it's been a lot of fun to implement those features and to continue to implement those or continue to improve those features. So it's been a great process.
Very good. Very good. Yeah. And we're, as you know, we're breaking this conversation into two parts because we wanted to do this more introductory conversation about measurement-based care, but it is great to get into the specifics of the questionnaires that we offer, and we talked about the KISPA a little bit, but excited to talk about the other questionnaires we have and share some of my experience over the years for part 2 of the podcast, which will be delving into more specifics.
Yes, we will plan to talk about that the next time we meet to sit down to record. So with that said, I think, do you want to transition into a mental health business moment of the week? Anything stand out this week?
Yeah, some things have been going fairly smoothly, but something that came up, and I think that a lot of mental health clinicians may face something like this. If you've ever worked for a group where you were credentialed with an insurance or ever went through the process of signing up for insurance, and this is where sometimes your name shows up with an insurance company that you are not actually contracted with. Mm-hmm. And then you get a family who reaches out and registers for service. And then when you see that they're with an insurance that you don't take, even though they got your name from that insurance company's list, it's not a great feeling for the family to let them know, hey, unfortunately, we are not with that insurance company. And yeah, if you come to see us, it will be out of network and not your $20 copay, but much more expensive. And this specific example, although I could see how this happened, it's a insurance company that, if you're in the state of California, has one list of providers, but if you're in any other state in the country, it's contracted out to another insurance provider. And so what happened was this family was moving to California. They were being proactive in trying to find services, and they searched, but they were searching from outside California. So our clinic came up because we are in network with the insurance that if you're in any other state besides California, then we would be in network. But when they got here, now they're in California, and unfortunately, we're not in network. But when they had done the search from out of state, we did show up as in network, and that's confusing to clinicians and groups. But you can imagine and this was as a parent trying to be proactive to arrange care, it's maddening. And so, we'll, as always, we try to provide some information we can try to get a single case agreement, et cetera. But
right.
It was a frustrating experience for the family involved.
Yeah, that is an unfortunately very common issue. I have found in my own experience of, when the insurance gives you a list of providers, sometimes it feels like 75% of them are no longer even in network with or even active. So definitely can be very frustrating. Well, anything else that you'd like to say before we wrap up?
No, excited to go to the part 2 of this measurement-based care topic. And yeah, excited for other stuff coming up this year.
All right. Sounds great. Well, there you have it. Thanks for joining us for this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you have questions, if you have questions you would like to submit to our audience Q&A or are interested in featuring as a guest on the show, send us an email at sitandstay@ripsytech.com. All right, Tom, I'll see you later.
Take care, Parker.
Thanks. Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at ripsytech.com.